Hi, I'm Dave Furman, Judge on the Colorado Court of Appeals and Chair of Colorado's Court Improvement Program.
I'm Minna Castillo-Cohen. I'm the Director of the Office of Children, Youth, and Families here at Colorado Department of Human Services. We want to share more information about the Family First Prevention Services Act, our work to implement the federal law in Colorado, and the latest developments. The Family First Prevention Services Act, which you may hear referred to as Family First or FFPSA, is a federal law passed in February of 2018 that allows local child welfare agencies to use federal funding, which is the Title IV-E, to pay for services that prevent the removal of a child or teen from their home. Previously, Title IV-E funding could only be used to pay for the cost of out-of-home placement services. The law builds upon the work Colorado has already been doing. Last year, of the 20,814 Colorado children and their families involved in an open child welfare case, nearly 70% received services in their own homes. To ensure children and teens continue to live with their parents as their parents address safety concerns, Family First will allow Colorado to fund up to 12 months of services to prevent a child or teen from entering foster care. This is an exciting opportunity to implement in-home services to prevent out-of-home placements with new 4E resources. The law requires that the prevention services provided have a proven track record, be based on data, facts, and evidence. Prevention services can include in-home parenting skill training, mental health services, substance abuse prevention and treatment services, and prevention services must be trauma-informed, evidence-based, approved, and subject to well-designed and rigorous evaluation. If it's not possible to ensure the safety and well-being of a child or teen in their own home, a caseworker looks to family or friends who are willing to provide a temporary home while the parent or caregiver works to improve the situation at home. These families are known as kinship families. Any safe adult with an established and trusted relationship with a child or young person, this is grandmas, uncles, teachers, neighbors, or even a friend's parent, all can be kinship parent. If no kin are available, we look for a foster family to provide a safe temporary home. If children and teens need care in a facility, we must ensure that it is the appropriate level of care, temporary, and treatment-focused. Federal funds can be used for placement in a Qualified Residential Treatment Program, or QRTP, for children and teens who need treatment. This is a new type of provider license. Specialized setting for young people who are pregnant or parenting, as well as independent living settings for young adults ages 18 to 21, and specialized settings for survivors of child sex trafficking, and family-based residential treatment facilities for substance abuse disorder are all allowable placements for children and teens under Family First Prevention Services Act. With all of these changes, we knew we could not implement Family First alone. Last year, a group of state staff, county representatives, providers, and other government agencies developed a roadmap for implementation. Today, an implementation team and work groups are working to identify placement prevention services and are working to write new rules with a goal for early implementation of Family First in January of 2020. Thanks to the hard work of the implementation team and work groups, Colorado's placement prevention plan is in the final draft stages. We anticipate that will be ready to submit in October. We are working with the DU Action Lab and Dr. Elisa Clemens to establish a mechanism to track our crossover youth. We have developed a rubric to prioritize possible placement prevention services to put forward for review for either transitional funding or for consideration of listing on the clearinghouse. At this time, there are just 9 services approved for 4E reimbursement on the clearinghouse. With new guidance from ACF, we have an opportunity to identify services that we think meet the federal government's rigorous criteria. We can begin offering those services and drawing down federal dollars while more services come online on the clearinghouse. We know our provider community wants to continue to serve young people in out-of-home care, and we want them to do that too when it's the right placement for kids. Now we're writing new licensing rules and helping providers identify how they may want to change their business model in order to use federal funding for care and treatment. Providers can apply to be a QRTP starting October 15th. When the QRTP portion of Family First is implemented, a current placement in a residential child care facility, group home, or group center will not be disrupted. With Family First, we are able to access more federal dollars to provide proactive services to support parents in addressing their challenges and seeking help. We believe that people can and do make positive changes in their lives. This new law helps us to do more to support that positive change.
The Family First Prevention Services Act, or FFPSA, designates Colorado's CIP to train judicial officers and legal professionals on key provisions of this legislation. CIP will collaborate with the Colorado Department of Human Services, Colorado Judicial Branch, Office of Respondent Parents Council, Office of the Child's Representative, County Attorneys Association, and best practice court teams to ensure stakeholders understand the significant changes brought about by the passage of FFPSA. For example, the FFPSA focuses on family engagement and evidence-based practices and requires judicial oversight to prevent foster care placements. Training will help to ensure that Colorado's children, youth, and families have a more positive experience in the child welfare system. The focus will include well-being, not just safety, as a standalone factor. Training will include judicial officers ensuring reasonable efforts are being made to prevent out-of-home placement. The reasonable efforts finding will take on new meaning and significance under the FFPSA. Legal professionals will need to understand risk versus safety and prioritize how to keep children and youth in their homes or with kin through effective, targeted services. Legal professionals will also need to understand that placement is about treatment and the needs of the family. It is not containment. Placement looks at the child's or youth's needs, not just what is available. Training also will help to ensure that children placed in residential treatment programs are in the least restrictive placement that meets their needs. The Qualified Residential Treatment Placement Work Group is developing a bench card that will be a helpful tool for judges when a youth is placed in this level of care. Finally, training will help judicial officers make more informed placement decisions using an independent assessment tool. This tool provides data-based recommendations about placement needs. Training on these topics will play a role in the success of FFPSA. But we see bold and lasting change happening through local efforts. The best practice court team infrastructure has the capacity to bring this legislation to life. Local teams should start meeting, take stock of what evidence-based practices exist or do not exist in their communities, and then develop strategies to achieve safety, permanency, and well-being for children, youth, and families under FFPSA's requirements. CIP also will continue to support and coordinate these efforts through the CIP strategic plan, which includes system change approaches that are complementary to FFPSA, such as dependency and neglect system reform, or DANCER, and permanent home. These will continue to be done in collaboration with the Colorado Department of Human Services and best practice court teams and other stakeholder groups at the local level.
Family First implementation is complex, and more reforms will be needed to continue to transform the child welfare system in Colorado.
We know Family First will help us all as we work to ensure children, youth, and families thrive.